So my name is Lisa Berry. I am a genetic counselor with the Rare Genetic Disease Program at Cincinnati Children's Hospital. So I work with families with lysosomal storage disorders, including Fabry disease. So when families first come to care and first either get a diagnosis or seeking a diagnosis, they very well may meet with a genetic counselor in order to have the testing performed. And that is something that in a lot of states, genetic counselors can order genetic testing. So, and Ohio is one of those states. So, they might meet with a genetic counselor at that point in time. And then certainly once they have a diagnosis, it's important to meet with a genetic counselor to talk about what the implications are for the rest of the family members, because this is a disease that does go through the generations and other family members. I think the average number, if you diagnose one person with Fabry disease, the average number of other diagnoses that occurs per family is about 5 other family members. So we can play a role in that part. And then one of the roles that I play, in addition to working with clinical trials, is care management. So there's a lot of things that we do to monitor our patients with Fabry disease and kind of keeping track of all that and making sure that if they're on therapies, they're getting those therapies, and then monitoring response to the therapies and helping them organize all of their assessments that they need. Yeah, so when we have treatments, it's always good to kind of check in and see how things are going with those treatments. And certainly from a provider perspective, as a person who doesn't have Fabry, I think, oh, it's so wonderful that we have, now we have 3 FDA-approved treatments for Fabry disease. So for me, it's very exciting, and we see that patients feel better when they are on therapy, and we prevent further damage from happening in their bodies because of the disease. So it's very exciting for us. However, it's hard for us to know really how those patients really truly feel. I hear stories one patient at a time, but that doesn't mean that people overall are experiencing the same thing. We wanted to see what people really think about their symptoms and their therapies and their response to therapies, monitoring. What do they really think versus what they tell you when they're sitting with you one-on-one in a doctor's office? We did an online survey of 280 adults with Fabry disease, men and women. So both are affected, but females can have slightly different onset of symptoms and slightly different severity of symptoms. So that's good to keep in mind. It was about a 30-minute survey, and we wanted to look at the patient's perception of their Fabry disease, their satisfaction with disease monitoring, and their experiences with treatment. And we gathered quite a bit of information. So first off, keep in mind that when patients are on the treatment with enzyme replacement therapy, they're getting infusions typically once every 2 weeks, and that's for a lifetime. It's not you get 10 treatments and you're done. So they're getting infusions every 2 weeks. And what we learned is about half of those patients are experiencing what we call temporary symptom worsening about 1 to 4 days prior to their next infusion. So, around day 10, 11, they start having increased fatigue, more pain, different symptoms that resolve when they have their next infusion. And then of those patients who experienced that, we learned, and this to me was something really surprising, only half of those patients reported this to their doctor, their prescribing physician. While we'd hear this from time to time, I don't think I had an appreciation that potentially up to half of my patients were experiencing this. We also looked at how often patients are getting monitored, getting the different assessments that we look for in Fabry disease, like heart monitoring of the heart, monitoring of kidney function. And we did see that patients who are naive to treatment or who are off treatment for whatever reason did not get monitoring as frequently as those patients who were on treatment. And I could see that because you're not going to the doctor as much if you're not getting an infusion every 2 weeks. We asked patients how they felt their disease was overall and if they were progressing or if it felt stable. And this was really surprising to me, although it is a progressive condition. So, but of the patients who had stable labs and assessments, 82% of those patients actually perceived that their disease was worsening. So when I see, when I see some test results, lab results, results of scans, I'm viewing that as stable. Well, clearly my patients aren't necessarily viewing that as stable if 82% of them felt like their disease was actually worsening. Our respondents had very limited information we do about their what we call ADA testing, or anti-drug antibody. So typically when a person is on enzyme replacement therapy, we do antibody testing, and we ask patients, how often are you getting antibody testing? And only 36% of those patients reported getting this testing. And then of those, a full third of them were unsure of what the results were. So not only are people not sure what they're getting tested for, they're not sure what the results even are. So that to me was kind of a wake-up call that we need to be asking, talking to our patients a little bit more about this kind of stuff. In Fabry disease, we tend to categorize symptoms as symptoms that you can see or feel versus symptoms that are silent. So definitely in this survey, patients talked a lot about the symptoms that they could see and feel. So the fatigue, pain, burning pain in the hands and feet that can be debilitating in some individuals, GI issues, GI upset, this severe diarrhea that can come on very rapidly, all those types of symptoms, the fatigue and just the general feeling of being unwell. Those are definitely all symptoms that our patients in this survey talked about, and that also worsened in that time period prior to their next enzyme infusion. And then the symptoms that you can't feel that are more silent would be kidney disease, problems with your heart, and then increased risk for stroke. So those types of symptoms, of course, unless you're experiencing something acutely like renal failure, or need a pacemaker, have a stroke, those they talked about less in the survey. And that's where the monitoring comes in, that we really need to be monitoring your kidneys and monitoring your heart function and making sure that if you're at increased risk for stroke, do you need some sort of intervention for that, like medication. So they talked less so about that, although we did ask them about monitoring. And patients on treatment were getting more monitoring, which I thought makes some degree of sense, right? Because they're just at the doctor's more if they're doing their infusions at the hospital versus at home. But the patients who are not on treatment, well, those are the patients who might be potentially more at risk. Perhaps their disease is more mild, or perhaps we're just not looking and we don't know. So I would say that it's probably just as important for patients who are not on treatment to be getting the routine monitoring. I think I felt like I needed to communicate better when I walk in that room and talk to families. And we do allow a decent amount of time to talk to our families with Fabry disease here. We have an advantage that we're in a genetics department. Our appointments are scheduled perhaps a little bit longer than a nephrology appointment or a cardiology appointment. So I feel like we have the time to do it, but I think also we need to just really sit down and talk and have a little bit more maybe back and forth that perhaps we're not having. We're asking a lot of questions, we have to type a lot in the computer, but perhaps it might be better just to have a conversation with them, because I think the overall result here showed me that I need to be doing a better job communicating and providing a little bit better education to my families. In the study, they didn't always tell us about their symptoms worsening. We could do a little bit better job explaining, I might send them down to the lab, but I don't necessarily tell them all the tests in detail about what we're going to be ordering or what those results necessarily mean. I think I speak about it probably a little bit more broadly, and everyone comes to this with a different level of medical knowledge. Most people, of course, have more of a layperson's knowledge. And then also talking more about disease progression and monitoring. So I think the takeaway message for providers and clinicians is to, really just communicate better and provide better education. I think that to me was the big takeaway, and not to just assume that all the patients know exactly what's going on, and that really to talk about disease progression and the role of therapies and monitoring.